Now, if there's one thing I want to help you with, it's solving spots. And I know it can be so difficult when it comes to formulating a good skincare routine to know what goes where, especially when it comes to unpredictable things like breakouts and blemishes. It can be hard to know which ingredients to reach for or how to apply them or where they go in the routine. And it's certainly one of the things that I see very commonly done wrongly. So with today's video, I want to give you a step-by-step guide that leaves zero guesswork so you maximize your chances of success. Let's start. So the first thing to think about is when to use a spot treatment. Now, typically, I recommend doing that in the morning. And that's because, generally speaking, if you are blemish prone at all, and you're likely to be if you're watching this video, you're going to be using a retinoid at night. So I think about the spot for your blemish treatment to be in the morning. Now, the one exception, if something horrendous comes up during the course of your day, which can happen, of course, in which case I will then carve out a spot, literally for it, in the nighttime routine. So that's the one exception. So the next question is what to use to treat a blemish. Now, I did do a video on this not that long ago, and I will link to this at the end. But in essence, you want to harness the anti-inflammatory properties of active ingredients that will help reduce redness, swelling, and then subsequently pigmentation. Now, my top one for that is going to be benzoyl peroxide, and I use something called Duac, which is a combination of benzoyl peroxide and an antibiotic called clindamycin. It comes in a 3% and a 5% strength, referring to the strength of the benzoyl peroxide in there. Now, over the counter, you can easily use something called Acne here in the UK, and in the US and beyond, you probably have lots of different options, but I tend to use nothing stronger than 5%, and I find that 2.5 to 3% is often more than enough. And the good thing about the benzoyl peroxide in this prescription-only preparation is it stops you from becoming resistant to the clindamycin. So I don't tend to ever really use antibiotics alone, unless in an exceptional circumstance you really do have a sensitivity to benzoyl peroxide, which can happen. Alternatives include salicylic acid, 1 to 2%. And if you're very, very sensitive or pregnant, then azelaic acid and niacinamide are often a good combination. Those are both found in Brightly serum. And bakuchiol can help as well, a strength of 1%. Now, in terms of the consistency, I think it's really important that you have something that's quite firm and gel-like rather than something watery and serum-like, simply because it's easier with a spot to be precise on application. So that's the first thing to think about in terms of consistency. And then the other thing to think about is the nature of the vehicle. Now, some ingredients require more drying vehicles for them to be adequately absorbed into the solution. And that can, sometimes cause problems because it can increase the irritancy factor. So if you're tending towards dry, irritable, but breakout prone skin, then something that contains occlusive ingredients like dimethicone, for example, which we find in the base of Duac, is a really good idea. Importantly, things that don't work on a brand new spot and that aren't worth putting on a new blemish, and I see this all the time in clinic, retinoids, they don't have much acute anti-inflammatory effect. They do have some over time, but it's not what you want to reach for when it comes to treating a new spot. And I do hear patients saying, oh, but that's what I've been putting my differin on the spots. No, that's not the way to do it. So retinoids don't work on spots particularly well, and vitamin C doesn't help particularly. In fact, I don't tend to use vitamin C in someone who's actively breaking out. That's something I use later on when skin is well controlled and we're tackling pigmentation. So when it comes to how to use it, so if you're treating a single spot, it's slightly different to if you're treating, say, a zone. And I talk a lot about acne zones because I think that's quite important. If you're prone to getting recurrent blemishes, for example, in the T-zone, it's quite different to that single spot you might get just before your period. So if I'm tackling a spot just before my period, I'm going to use a very small amount of my topical. I'm going to just put a little tiny bleb, less than a pea, on the back of my hand. And I would use this directly onto cleansed skin because I know that my skin can tolerate that. So the way to get the maximum benefit from a product is to apply it to clean, dry skin. So just washed my face with Flawless Cleanser, patted it dry, and then, I mean, I have a tiny little thing up here. So I would literally dab the smallest amount and then massage it in to the spot. Literally just on the blemish. And if your skin is very sensitive, I'd even go as far as to take a Q-tip and clean up the edge if it has leached too far away from the active blemish that you're treating. Now, if you're dry and sensitive, you can put that on over moisturizer. Buffering, again, it's a common technique. And I know that benzoyl peroxide is quite drying for a lot of you. Now, somewhere up here, not a big deal, but maybe down here, your skin's a little more prone to dryness, especially if you're using a retinoid as well. So I have no problem with you erring on the side of safety by putting your moisturizer on first and then treating the blemish. However, if you have a zone of breakouts, a mixture of closed comedones, those little blind skin-colored bumps that are the precursor to future spots, and you have a few sort of a spattering of blemishes mixed in, then you want to treat that zone, in which case I would do this. I would literally do 1, 2, 3 if I was treating that area, and then again I would precisely massage it in to make sure that I'm covering the area that has those little time bombs, those closed comedones, and has also got the inflammatory spots that I want to treat. So I think it's important to see that I'm dosing according to the size of the area that I want to treat. So I'm not going to put loads and loads of product on any one site. Again, I think that's a fast track to dry, crispy bits. And potentially the irritancy actually might make the spot worse. So you want to dose it carefully, with restraint, literally just enough to cover the area. As I said, I haven't even used anywhere near that full amount. Again, I would extrapolate. If I was treating along the jawline, I would do the same thing. 3 small dabs in each of those areas to treat an area, you know, that kind of size. So you don't want to overdo it. Even though it's tempting and you want to get in there, be restrained and know that you're going to be doing this for a few days until you get complete resolution. The other thing to say is that I wouldn't then layer any other actives over the top. I often get this question, can I combine X with Y? Things like benzoyl peroxide, ingredients like retinoids tend to be used in isolation because you're trying to harness a very specific action from them. So with the retinoids, it's about your prevention steps. And with your benzoyl peroxide or salicylic acid, it's about the sort of correction, the anti-inflammatory properties. So you've treated your zone, and this could be a zone here and here if you suffer from teen zone acne, or all along here if you're suffering from adult sort of female pattern acne. So you've done your layer. In the morning, if I had just a single blemish, I might then go on to use something like Brightly Serum on the rest of my skin. So I would tend to sort of then, you know, delineate a line here, and then I would treat upwards with another product. So you can use 2 products at the same time, but just don't double layer them in the same area. And I think that way you can continue with your preventative work or to treat some post-inflammatory pigmentation at the same time, but target the blemishes with the right product. And as I say, if you're treating a zone, be respectful and be careful, because you don't want product applied here and product applied here mixing. You'll just get dry, irritated skin. So once that's fully absorbed here or here, depending on where you're applying it, I would then go on to do my moisturizer duvet layer, Flawless Moisturizer for me, just because we're wanting to build up layers that we can then ultimately, you know, apply concealer over the top. I mean, I'm really careful about this whole process, and that's why I want to share these details with you, because at the end of the day, you know, we still have to go out and face the world. So I will use a layer of that once this is fully absorbed. It's completely touch dry first. So I don't want to be moving around the duac onto other areas that it's not destined for, basically. Then I'll do my sunscreen, because of course we want to reduce the chance of post-inflammatory hyperpigmentation. So we never skip sunscreen, even when we have breakouts, and then a little bit of makeup. And for me, that's just a bit of concealer applied strategically. So that's it in terms of how. Then the next question is, how long do you do that for? And I think the answer is basically until the blemish is flat or if you're treating a zone with closed comedones, essentially until those have cleared. So with the blemish up here, I might repeat that daily for 3 days, maybe even 5, just until it's completely flat, and then I'm just left with any little bits of redness and pigmentation, which I can then move on to treat with azelaic acid, which is better for prevention and for post-inflammatory hyperpigmentation. Otherwise, I would keep going. So if I was seeing someone who was recurrently breaking out along here, and that's such a common picture for me to see in the clinic, I would essentially keep going with that daily benzoyl peroxide or alternative preparation until I achieved clarity. Now that might take 2 weeks, it might take 4 to 6. It just depends on the severity of things when we're starting out. But essentially you want to keep going until you've got clarity, tackling new or pending blemishes. And then once you've gotten them clear, you can think about prevention. As I say, that's where I tend to bring in azelaic acid, having kept the retinoid going at nighttime all the while. One strategy I use for people who tend to just break out before their period is to think about swapping in benzoyl peroxide or an alternative for the week before their period, just as a sort of preemptive strike if you're prone to getting blemishes in the triangle of doom below the corners of the mouth, which is terribly common. Sometimes bringing in a sort of an advanced attack with the anti-inflammatory can just prevent you from getting blemishes altogether. So hopefully you are now brimming with confidence in how to approach a new breakout when you get one, and you have an idea of what not to do and a step-by-step guide of exactly what to do. And that should really make you feel capable, and I know you've got this. So if you've enjoyed this video and the other how-to videos like it, please make sure you share them with someone who would benefit, because I really do want you guys to feel that breakouts are a thing of the past. Thanks for joining me today. Bye for now.